everybody. Thanks for joining us tonight. I am so excited because tonight, on episode 4 of The Whole Truth, our little vlog here, I've got a good friend of mine, Dr. Alex Runnels. We worked together many years ago when I first
like 100 years ago.
I know, back in the Cretaceous era.
It was the time is the before times.
The land before time. So, Dr. Alex is here tonight because we are going to be talking about sex. Is it good?
Mic going?
Did you?
Perfect. Is that better? Anyway, Dr. Alex Runnels is my guest tonight. We are going to be talking to you about sex, and there's a reason why we're going to be talking to you about sex, and it's because we are sexperts, right? So we're both OBGYNs, but we've both left behind the obstetrics part, and Alex is the owner of the Scarlet Phoenix, an aesthetics and reconstructive and vaginal rejuvenation, like a boutique gynecology and aesthetics practice, downtown or at the Pearl, or where are you located?
It's at the Pearl.
Fantastic.
It's right next to Black Swan Yoga.
Awesome.
And it's a great walk. Go
So
have some
nice.
lunch and walk over and have a little treat.
Come and get your Botox and then do a yoga class.
And do yoga and then come back and get a no shot and go home and party.
What a great day. I'm a yoga shala aficionado, but I do love yoga. So I can't wait to come down and check out your new practice, see everything that you're offering. And we are both trainers for Dr. Runnels. So Dr. Alex Runnels is not Dr. Charles Runnels yet, but they are in a relationship, and he is engaged. I wasn't sure if I could make the public announcement.
It's okay. It's not a secret.
So the developer of the O shots and P shots and the vampire procedures, and we are both trainers for other physicians and nurse practitioners and mid-level providers who want to learn how to perform these services, sexual enhancement procedures. So we want to talk a little bit tonight about sex, why sex is important, and is sex important? And if it is, why is it so important? Because we think it is, and we want you to have more of it, and we want you to have the best sex possible. So tell me a little bit more about the Scarlet Phoenix before we dive into the meat of it.
Absolutely. So the Scarlet Phoenix was a idea that I came up with about 5 years ago or so, and it was about came to fruition right when COVID had happened.
Wonderful timing.
So
Good
I
job.
had finally gotten the space built out
Yeah.
and all my stuff in the space and ready to go, and there's COVID.
What a nightmare. Yeah.
What a nightmare, but it worked out. But what it is, what the Scarlet Phoenix is it's a concierge GYN practice, and we focus on all things GYN.
Good.
Hormones, aesthetic stuff, so Botox, filler. We do a lot of vampire procedures, O shots, P shots. We treat incontinence with a variety of things.
Fantastic.
O shots, Emsella.
You've got an Emsella?
Mm-hmm. We do a Thermiva. We have an Emsculpt.
I love the Thermiva.
We do IV vitamin treatments.
Fabulous.
We have
wellness.
Just anything almost anything you can think of.
Yeah, just a big wellness practice.
Basically, I created a space for the demographic that I am in now.
Yeah.
That I would want to go to.
Perfect.
And
how fun. We can get everything that we need done, and it feels like a spa experience.
And it's a place that people can come and talk about sex comfortably because they get pretty much 1 hour at a time, and
I love it.
And it's great, and they're just happy. They're happy there, and they're happy to open up. And,
absolutely.
And they don't have time. They don't have time to talk about it in a regular 15-minute doctor's appointment.
Right. I was just going to say, it's hard to really communicate the compassion and the empathy that you really need to help people open up in a 10 or 15-minute
It doesn't happen.
appointment. It's very awkward.
It doesn't happen is what it is. That's why it's not addressed. I mean, what mostly happens is when the doctor's hands on the door, it's that last, doctor, one more thing, and then they lose their nerve.
We all know that. It's frustrating. But so it's exciting that more and more providers are starting to really kind of address these issues and create a comfortable space for women. And we offer a lot of the procedures. Ours is not concierge, but for vaginal health and rejuvenation. And I think sex is really important, and I know you do too. And we've got some science to back it up. And I know people will say, like, that's kind of soft science. That's great. It's very hard to get medical research funded and approved and to move with it. But these associations are important. And so I think sex is important for a variety of reasons, right? I know that we were talking before the show about some of the studies that have shown things like improvements in people's sleep patterns, improvement in their cardiovascular health, lower rates of prostate cancer for men who have how many 21 ejaculations per month, things like this. And I think it's fascinating.
And there's the argument for the opposite, for men to do the opposite and do a sexual transmutation.
What's that?
Oh, that's a whole nother thing.
A transmutation. That sounds like fun. Maybe? No?
Well, that's another show. That's a whole nother show.
Perfect. So yeah, and based on some of the other associations that I've seen, people who have more active sex lives have better memory and cognition. They tend to have better immune system support. I published this little article that I found on PubMed talking about IgA, which is a mucosal antibody. So it's
Saw that one.
Yep.
So interesting.
present in like the lining of the vagina and of the mouth and the nasal passages, that was showing if you have good levels of IgA production, that it tends to prevent adherence and entry into our systems by viruses. So COVID specifically in that article. So again,
I love that. I love that article.
I love
So
that.
what I didn't get through the whole article. So what about, I just thought, what about how is it the act of sex, or what about it increases the IgA?
So I think I didn't get down into
I'm not
it.
trying to.
No, you're good. The mechanism of action of it, but I've seen it also like before this article. I saw it specifically talking about HPV, right? So if you've got better vaginal integrity from either hormone use or Thermivas or some rejuvenation therapy, as women get older and they lose their hormones, or if you're on suppression,
I see what you're
like
saying.
your birth control, then the vagina's not healthy.
I see what you're saying. You're not. I was thinking it was a causative thing. It's more of a okay.
I think it's more that the fact that
The
if
healthy
you,
vagina
Yes.
is preventing.
Yes.
I love it. I
And the
love
vaginal
it.
microbiome. The microbiome is like my new obsession too,
Yes.
the different microbiomes. But having more frequent sex promotes better circulation, better collagen production, better firmness, slightly better bladder control. So all of those things are related to the stretching and the elasticity and the blood supply to the vagina, and better mucosal immunity. So hell, I don't think, well, maybe some people do need a reason to have sex more often. And it's certainly, like I said in my little disclaimer, I'm not saying it protects or prevents COVID, but if it looks promising in this one Asian study, I think that's reason enough, right?
I agree with you.
I think so.
I think so too.
So we've had a lot of fun doing all the vampire procedures.
Oh, have you?
Oh, yeah.
They're super fun, right?
I love them. And I saw a video of you doing a vampire facial the other day.
Oh, yeah.
Awesome. And your patient said it felt relaxing.
Yes, I'd found a new cream to use that makes it very. It used to be a little bit uncomfortable with the cream that I was using.
Yeah.
And I found this new cream that makes it they just say, oh, this is lovely, and they don't complain at all. So it's just more comfortable for the patient.
We want that always.
And then I also made a video too explaining the difference between a facial and a facelift, because that gets asked all the time. So that's available on my website somewhere too.
Very different things.
Very different things.
Yeah, we're happy to share your websites and all of your new practice information.
It's thescarletphoenix.com.
Yeah. So, do you want to just give the patients or the viewers, an overview? We're going to talk about the vampire procedures now a little bit. So, about some of the ways that you can improve your sex life and keep more active and keep your libido up and all of those things. Because, the most important sex organ is the brain. And there's a ton of ways that we can help patients to kind of stay engaged and connected with their partners. But I want to just go ahead and kind of jump into the money here. And so I wanted to talk a little bit about some of the procedures that women can get at either of our practices to help them with some of the things that you mentioned, right? What were you said some of the main things for an O shot, the benefits that a woman can expect to receive if you come in and get a procedure called an O shot, and then we'll tell you what it is.
Okay.
Yeah.
That sounds good. I haven't had a chance to do this, but I want to say first, thank you so much for having me on the show. I'm super flattered and honored. It's a great honor to me. I know you well. We worked together from the beginning, in the early days, and it's just such an honor to. We shared an office space with desks in the same office.
Sure did.
You can't work any closer than that.
It was crazy. Yeah,
and
it was a lot of fun.
To see us both have kind of come full circle around to the same thing is really pretty cool. So I'm really excited about this partnership in this way. Even though you're all the way across town, it's people out here need stuff,
Yeah.
people over there need stuff,
Yeah.
and there's stuff you do that I don't do, and stuff
Absolutely.
that I do. Is
Yeah,
what
of
I'm trying to
course.
say.
Yeah, it's like a good blending of services
And you just were
complementary.
always so bright and had good
You're
work
so
ethic,
sweet.
and I really always loved working with you. So I'm excited I'm bragging on you because
love
you
you. Yeah,
deserve
thank
it.
you.
I'm
You're a
just
doll.
bragging on you.
No, I'm
But-
excited for us too because we both kind of made our way around to this same place. Like delivering babies was wonderful and rewarding.
It is. It's very rewarding, but
Absolutely.
it's a beatdown.
It was a total beatdown. So I just feel like I got my life back. No hospital medicine. You still operate.
Not in the hospital. No
Okay, good.
hospital work. I do in-office procedures,
Good.
in-office labiaplasties.
Awesome.
Anything I can do in the office.
Yeah.
Nothing in the hospital.
Right.
No insurance. All cash based.
Perfect. I feel like cutting
And
the ties
lots
with
of
the hospital.
lots of different
yeah.
packages and things that make it to where it's
It's
affordable.
Right. And these are splurge things, but right, these are things that I think a lot of women
Some are
want and
splurge,
need.
and
Yeah.
some, I think, one day, 20 maybe years from now, every woman is going to be getting an O shot after every baby that's born.
Hopefully not 20 years, but yeah.
Maybe 10 years from
Yeah.
now, I don't know. After, every so often, after each, rite of passage through female life, because
Transitional
it's
change.
just, it's going to become a thing. I know.
Oh, it's already there. I think it's fabulous, and maybe once we talk about it later on, we'll share a little more. But maybe not. Maybe that'll be like coffee or something later. So
I'll do whatever you want me to do. If you want me to talk about, about the procedures?
Do you mind explaining what women would expect to receive, or why someone might want an O shot?
Okay.
Yeah.
So O shot stands for orgasm shot.
Mm-hmm.
There's two main indications for it. It's basically it's used. It's different than the old G shot.
Right.
Dr. Matlock
Right.
came up with. That was created and developed to make good better. The O shot is not for that. The O shot is to treat dysfunction. It's to treat something wrong and make it healthier.
Help restore normal function.
Yes. So there's the two main things that it treats are sexual dysfunction and urinary incontinence, and it can be a variety of forms of urinary incontinence as long as they don't need, they don't have major anatomic defects where they need a full
Pelvic floor reconstruction.
right. If they've
your
got
bladder's
a
not
grade
falling out,
3 cystocele and their uterus is hanging between their knees, this is not going to help you. But if you're like most women who don't need the full-on surgery but leak when they cough and sneeze, and they've stopped doing certain exercises because they're tired of embarrassing themselves or whatever, this is a home run.
It's a game
It's just
changer.
it's a game changer, and it also helps with a lot of other things that are kind of the things that the urogynecologists and the urologists hate to treat, because it's the things like
Overactive bladder.
interstitial cystitis is not as hard to treat. This seems to help some people with
really
it.
does.
Frequent UTIs, we're not really sure, but the data's not there, but we see it. I see it get better.
And the overactive bladder component.
Overactive bladder.
So stress incontinence, right? I think most people are familiar with. It's what so many women experience. Even if you haven't had vaginal deliveries, sometimes just the collagen issues or life or things like being overweight or coughing make your bladder weak, so that when you're sneezing or jogging, you pee a little bit. It's very embarrassing. And then
Up to 70% of
it's
women.
huge percentages of women experience this. And then overactive bladder is a situation where the bladder muscle kind of spasms and contracts, and it can force out urine, so you leak a little bit in those instances, but it's really uncomfortable. And there is really just fascinating effects of the PRP on the bladder muscle layer to kind of relax it. And the drugs that we usually use to treat that condition are so dreadful.
The things that are out that are available are horrible. I mean, yes, you can wear a diaper, you can take anticholinergics and be constipated, dry
increase your
mouth,
risk for dementia.
and get demented, and then wear your diaper and be demented.
Oh, God.
And be tired and sleepy all the time and constipated. That sounds fun.
No, not me. I'll pass. Next.
Yeah. So there's some people still need mesh procedures.
Sure.
It's still a need.
Absolutely.
But there's a huge population of people who don't need surgery
Yep.
and don't really have a good answer. And this really, it's not snake oil. It really does work.
It works great.
It really does work. But it was a side effect actually that was noticed after the O shots were starting to be done for sexual purposes.
Mm-hmm.
And so it wasn't originally developed for that. It just was something that was noted.
Yeah.
Wow. Okay. All the patients are coming in and saying, you know what? I was leaking urine all the time and now I don't anymore.
Isn't that great?
So,
what a great side effect.
I mean,
Yeah.
you couldn't be luckier, really.
It's fabulous.
But it was originally developed to help with sexual dysfunction. So that two things so people that have a difficult time achieving orgasm or anorgasmic, those are harder cases, but difficulty with the orgasm is one group of people with decreased desire, decreased arousal, pelvic and pain, dyspareunia, pain with intercourse from multiple reasons. There's reasons because the vaginal tissue is too atrophic and dry and it hurts because it needs some love. And some people have breast cancer or have a history of something that
disorders.
makes it to where they can't or don't feel comfortable taking hormones. And so this is a real treat for them because they have grown to live with this painful vagina situation that makes it to where they can't have sex anymore. And then you do an O shot, it's amazing. Do one O shot on these patients and it turns the clock back. They come back in and they say, it's like I'm a teenager again.
Yeah.
I have the lubrication and it doesn't hurt and my vagina
the
can
elasticity
stretch.
and the increased orgasms. And so these things can happen for so many reasons, like Alex alluded to, right? As women get older and they go through menopause, even perimenopause. You mentioned earlier having a baby, right? The stress of that. Most women, after you just had a baby, you pee on yourself a little bit because everything's kind of just stretched and has to recover and it takes a little while. Then if you're breastfeeding, your hormones are suppressed. So it's kind of similar to being in menopause because you're not producing any of those hormones.
It's the cruelest joke of
Everything's
ever.
going through your boobs.
Right?
It is, yeah. Yeah.
You have a baby, you get thrown into what feels like menopause.
Yep. Oh, yeah.
And you pee on yourself all the time.
It's good times. Newborn life is rough from so many standpoints, but it's wonderful. And then there's a ton of like drugs that can cause issues. Antidepressants, sometimes birth control pills.
Oh, how many years did we prescribe birth control pills
So
thinking that we were doing somebody so much favor because we were preventing ovarian cancer one day?
Right.
But really now, look back on it, I'm like, what? We deprived these people of their hormones for so many years.
And for a long time, because we're told by our college that those things are all in their head and that there's no science to support these procedures. Well, it's not true. The science is different than phase 3 trials, but there is wonderful research that shows benefit, and there's anatomic studies and pathology slides showing improvement.
And one of I think the argument for that is that the substance that's being used for these procedures, PRP, platelet-rich plasma, has been used for 30 plus
forever.
Years. Started out in orthopedic surgeons and dentists, and they needed to figure out a way to have these very poorly vascularized spaces heal faster. And it started out with $1 million racehorses and elite athletes so they could get them back out there again. And they needed something that would bring blood flow and help things heal. Yeah. And so that's how it started. And then they have so much data of the safety and efficacy of it. There literally are zero risk factors for putting somebody's PRP back into their own body anywhere.
I agree.
There is not.
It's
more dangerous to give somebody antibiotic for sinus infection.
Exactly. The real risk is the blood draw, right? We're more likely going to cause a hematoma or something.
Yes.
But for people who don't know what PRP is, it stands for platelet-rich plasma. And so when we're doing these procedures, we draw the patient's own blood and then isolate it in a centrifuge. And there's special FDA-approved collection kits to kind of optimize. And within the plasma fraction of the blood are just thousands, millions of growth factors and cytokines, which are chemical signaling messengers. When you inject that into a poorly vascularized tendon, It stimulates new blood vessels to form. It stimulates the production of new collagen, new glandular tissue, and so I love it. You can do it in your face for improved complexion and rosy glow, and to decrease hyperpigmentation. You do the vampire facials.
I do the facelifts and the
And the
facials
facelifts.
and the breast lifts.
Yeah,
And
I do the breast and the
wing
vaginal.
lifts. Yeah.
But I'm afraid of the face.
The face, you gotta.
Yeah.
I'll work with you. That you can't. Don't be afraid of the face. You'd be wonderful at
That's
the face.
what Tamara says. Like,
You'd be great at the face.
it's not rocket science, but I'm
You're good.
definitely
You're
afraid.
good with your hands.
Yeah.
You're a good surgeon. You're good
Yeah.
with procedures. You'd be
Yeah.
fine.
I like do my best work below the waist, right?
You know, it's crazy though. How comfortable were we rushing a patient back to the OR who's bleeding to death and got to get the baby out
Yep.
and the baby's about to die,
Yeah.
and we were comfortable doing that. But
Oh,
then
yeah.
when you start doing stuff like this, it's like, what? I'm gonna stick a needle in a
someone's
patient's face?
Yeah.
But you get over that pretty quick.
Well, maybe
So,
I'll venture out of
I
my
have
comfort
really
zone.
enjoyed doing both
for
these procedures and the facial vampire stuff, fillers and Botox. It really all goes together.
Yeah.
Really, I mean, sex and beauty and love
Mhm.
are all wrapped up into one big happy ball
Absolutely.
of
Of
joy.
wellness.
Yes. so
Kumbaya.
so when you start having more sex and you start
Yeah.
being happier, you want to look your best. It's all about, I mean, it just kind of all goes together.
Yeah.
So
I like to make that point too for people. It's not about vanity. It's about self-esteem and feeling comfortable and
is.
confident. Because when you
Confidence.
feel confident about yourself, it changes everything. Your demeanor, what you project to the world. It changes how people perceive you. Changes how you can interact with others. It helps you to get your glow on and just to be the best you that you can be.
that
Yeah.
that brings me to something that I was thinking about today, knowing we're going to meet and talk about
Yeah.
this, about how important it is, how important sex is in general, and having a libido. And how many times have you seen a patient and you ask them about their sex life and they say, oh, that's fine, and it's not fine.
Yeah.
And when you think about it, the reason that the human race exists is because of sex.
Yeah.
I mean, yes, oxygen and food and water
Right.
are important, but
Yeah.
the number one thing that has to
The
happen
perpetuation of the species
is sex has
requires-
to happen, which means there has to be a very powerful drive
an undeniable urge, desire,
throughout the human population to make that
connection
happen.
to procreate.
Right. And
Yeah.
so imagine how powerful, if something so powerful, imagine that urge and that desire goes away one
Yeah.
day. Imagine what else goes away with it.
Right.
Because all of a sudden your motivation, your ambition, your desire to be creative, thoughtful, intellectual
Yeah.
goes away with that fire in your belly.
Yeah.
And that's what I have had so much soul satisfaction with
Oh, yeah.
treating my patients, getting their
Totally.
hormones back in
Yeah.
balance, helping them have comfortable sex again,
Yeah.
reuniting couples that were about to get divorced
Yeah.
because their sex life was
It
so
feels
bad.
really good. It
And
really
then
does.
it's amazing. Or fixing a
agree.
woman who couldn't have sex anymore because of her
Yeah.
condition that, things like lichen sclerosis,
Yeah,
that
we have
people may or may
handfuls
not
of
know what
those.
it is.
Yeah.
But things that used to be our hard cases are now our easy cases.
It's really, really gratifying. I mean, it may not sound like it's that important, but you really do give people their life back. And I have people who come and bring you gifts or hug you, or their husbands send you flowers and stuff because they
Oh, yeah.
haven't been able to have sex. I have one patient that I love and think about. After a hysterectomy, there was some issue with it, and we had to do a few creative things with the PRP. 25 years they hadn't had vaginal intercourse. When I saw her, and the first thought was, holy cow, there's no way I can undo 25 years. And within about 2 months, they were able to have sex. And within, 4 to 6 months, they were having sex regularly. And I just went home and just said, thank you, God.
Those are the stories that
Yeah.
that are make
Yeah.
getting up and going to work every day worth
Exciting.
it. So exciting.
Mhm.
So exciting. I have a handful of those too.
I love
and
it.
Just love it. I
Yeah.
love it. And I love it when they pick up the phone to call.
Yeah.
They don't have an appointment
Yeah.
to tell you. They pick up the phone and call and say, I am so excited.
You know
I
what
have
I
to
love?
tell you about this.
I love it when they go on Google and drop a 5-star review.
Yeah. Yeah, then say.
Shameless plug.
I should- yes.
But no, it makes a huge difference in people's lives. And we just published, Mike Anthony just published a blog, because we were talking about this like insatiable urge for the procreation of the species. And absolutely, and when it goes away, you hear like the resentment and the frustration. And there was a PhD article that I wrote that said when couples stop having sex with each other, their relationships become prone to anger, detachment, isolation, infidelity, divorce, right? And we know there's huge rates of divorce, and there's tons and tons of reasons, but there is a connection and an intimacy that that is beyond just hedonism and procreation. That's a connection between two people that I think is really important for them to keep. And when I read articles, they say these statistics, they quote these statistics like up to 26% of people have low sex drive. And I think, geez, in my practice, it seems like it's about 80% of people. But maybe they select for us because they know that's what we do. But I definitely think it's more than a quarter of the population.
Oh, I strongly agree with that.
So maybe
strongly agree with that. I think what it is that so many people have just become complacent about it. It's for whatever reason uncomfortable, makes them not feel good, so they don't even want to have sex, and they don't know what it is that they're missing in their relationship.
And they say it. They say, "I love my husband or my partner. I love them so much, and it's causing a lot of interpersonal strife and discord. And he thinks or she thinks that I don't want to be with her, and it's just not the case." And I just love the O shot will sometimes do that. Like you said, the hormones are a big piece of it. There's all these other fun new prescriptions and compounds and things that we can order for patients to work on libido. So I do think it's really important for patients to keep that.
It is. It's critical. It's critical, and you can see it. You can see it in their faces when before you've treated them and after things have gotten better. And I can't tell you how many times I've been hugged, and just like you said, hugged, cried on. The husbands come in, hugs me, like thank you so much for giving my wife back, or vice versa. Sometimes the women are like, I need you to do something to my husband because he can't keep up.
Totally, yeah. I love that. That's one of my favorite ones when I'm like, whoa, tiger. Maybe we need to dial you down a notch or two, but like whatever y'all want. Yeah, and one couple talks about chasing each other around the room. They're in their late 50s. I think that's adorable.
It's adorable. Yeah. I mean, I think you should have sex until you put your foot in the grave.
Agreed.
And so part of sexual function is maintaining the rest of your health too. So you can't just do this stuff and do nothing else. You have to have daily practices. Sleep. You have to have good diet, meditate, exercise, get your miles, whether it's on foot, walking, running, whatever it is, lift some weights, do some fasting, do some praying, do some meditating, get, all the good, it's critical. Because without a healthy body, you can't enjoy healthy sex no matter what you throw at it.
And some of these interesting studies that I saw showed greater longevity for patients who have more active sex lives and fewer heart attacks and things like that. And so when I kind of like delve into that, it looks like because the hormones that are released when you're having sex and when you're having an orgasm, like oxytocin, has a relaxing property on the blood vessels, and endorphins and serotonin, and all these beneficial hormones and neurotransmitters get released that do a lot more than just give you an orgasm. They cause your blood vessels to be in a relaxed state. They decrease cortisol production. They do lots of things that we aren't aware of, but that have beneficial side effects.
And so many people aren't even aware of the reason that all of a sudden after they had that, they had a nice sex event with their partner, had a nice orgasm, and then lo and behold, they were able to write a chapter of their book, or they became creative, or they had the motivation to start the project that they had been putting off, or I do think that the more those, what you were talking about serotonin and oxytocin and dopamine and all that, more of that flows, the happier you are, the smarter you are, the more creative you are, the more intelligent you are, and it really is all
more alive.
Yes.
Yeah.
Alive.
They say that men
Alive.
have bigger dopamine surge after sex than women do, but dopamine is one of my drugs. I love dopamine. I love the reward factor to it. So it's a good thing. We want to be able to help you. There's an analog to the O shot. It's called the P shot, the Priapus shot for men, because it's very common for men, even at younger ages nowadays, with all the stress and the poor sleep and the poor eating habits, for them to start having microvascular disease. And when the blood vessels to your entire body, whether it's to the penis or to the brain or to the eyes or wherever, when those blood vessels start to get compromised, you lose your circulation and you start to have deteriorating function, whether it's to your sex organs or to your liver or to your immune system. And so it's really, really important, like you were saying, the exercise that you
and really the penis is the last thing to get blood from when the blood's pumped from the heart. It's the last. It gets the last of it.
it's
So
not considered a critical function.
so if it's cardiovascular function's not good, then likely going to have some erectile dysfunction.
For some of us, penile function is a critical function.
It is critical.
In our relationship.
It's critical to make certain types of sex work. I guess there's always other options, other kinds of things that you can do. But what the P shot does is it helps restore some of that lost, some of that elasticity. It gets stiff. You lose endothelial cells, and so with the cardiovascular problems that men have with their erectile dysfunction, by injecting PRP into the body of the penis,
the muscles,
it rejuvenates the penis. You use a penis pump, which people always want to talk about Austin Powers, and it's not my bag, baby, but it really works.
It does.
Really works, and I think men at early ages should start doing P shots and penis pumps on a yearly basis, just to maintain their erectile function for the rest of their life. It's a whole lot easier to maintain it than to get it back. So you can do a P shot on a man that has to take Cialis or Viagra, and they will have a good response. They can maybe decrease their dose or get off of it altogether. But wouldn't it be great to not have to get to that point in the first place? And so that's where some of the exercise and the being healthy stuff comes
Maintaining your health. And we were talking about these procedures, and then I just wanted to point out, these are, they're temporary for most people. They don't last forever. But when you think about, like, for a woman with a weak bladder, this procedure may not be covered by insurance, but when you compare and contrast and weigh the risks, benefits of the surgical risks, and how many bladder lifts and slings have you seen go wrong? So many that would be the last resort for me if I were in a position. Now, I'm just going to take a peek at some of our, see if we've got some questions here.
While you look at that, just to piggyback on that, this is something you can go do on your lunch break and go back to work. There's no downtime. Literally go have it done, go back to work. You don't have to rest or take any time off of work. I mean, you can go home and have circus sex that night if you want. No downtime.
Charles tells a really funny story about a couple that went into the bathroom
and
had sex immediately afterwards.
Yes.
And I thought, well, you probably didn't feel anything because the numbing cream didn't wear off, but it still works.
That's why you can do it with just ice. And anyway.
So funny. He did tell us about that too, and I want my numbing cream. So we have a question from someone that says, what is the procedure process for the O shot, and is it good for women with hysterectomies? 100% it is good for women with hysterectomies.
Absolutely.
Sometimes the active, where we have to make some incisions when doing the hysterectomy, can damage some of the nerves, and so that can compromise certain types of orgasms, and sometimes doing the O shot can help to restore that. And especially if you had to lose your ovaries and you lost your hormones, then you can expect hopefully better orgasms, better elasticity, better sensation. But the process involves coming into your doctor's office once you've done your consult and scheduled your appointment. I usually tell patients to plan for it to take about an hour. We draw their blood, and then we take them to our procedure room and have them just rest and relax, and then either I or my medical assistant will come and help to apply the numbing cream, and then we let you rest. We also offer Pronox. Do you use laughing gas?
I don't use Pronox. I give all my patients, I cheat. I give them an oxytocin troche
Sweet.
before each procedure.
Awesome.
Trick them into falling in love with me and
it.
falling in love with the
So
procedure.
Awesome.
It relaxes them quite a bit.
I love oxytocin.
And if
Yeah.
they're very nervous people, then I'll usually give them a Xanax or Valium or
Yes.
something ahead of time. But
Yeah.
most people don't need anything because
Agreed.
it's
It's
almost
scarier.
painless.
Yes.
It's pain-free to almost painless.
Yep.
And people are scared of it
Yes.
because they think needle
Needles.
going into what?
Yeah.
But this wouldn't be a thing if it hurt.
Exactly.
Because if it hurt, everybody would walk out the door and say,
Right.
that shit hurt.
Negative.
And
Correct.
nobody else would ever get it again.
That's what
So-
they say. That's my favorite thing, and I don't tell patients that until the end because I like to set the expectation low, or have them be happily surprised. But at the end, 8 times out of 10 they'll go, "That's it." And you're like, "Yep, we're all
That's
done."
it.
Yep.
That's it.
And so it's nervous, but so then in addition to the numbing cream, you can use ice, and then like Alex said, some people with a high pain tolerance might not even want the numbing. I would always encourage them to use the numbing. But,
Yes.
And then we
I don't
yeah.
push that on any of my
Good for
patients.
you.
No. Patients get whatever numbing they want.
And we've got these new 50 milligram CBD gummies that I just love so much. So that would be another great thing that maybe I can offer patients in place of an oxytocin troche, and they'll just completely chill for the procedure. So with the numbing, then we hold some ice onto a skin flap that carries a nerve to the clitoris, and then we give some a lidocaine injection. And I tell patients, if you feel anything, you might feel the tiniest pinch and then some pressure, the fullness from the lidocaine being injected, and then that's usually about it. And I will say honestly, I think the women tolerate it better than the men.
They really do.
But,
They really do.
Yeah. We do have the laughing gas for people if they're super nervous, and it's nice. It just kind of chills you out.
But I would agree with you that almost every time I do one, when we're done, they say, "That's it? That's it?" They really were expecting it to be just something so much worse.
I love that.
Yeah.
That's
And
my
so,
favorite thing.
yes,
That's it.
I
We're
love
all
that.
done. What? And then we have another. What about pelvic floor rehabilitation? So I think
Oh,
pelvic floor
yeah.
therapy is wonderful.
It's
Yeah.
for females or males, do you think?
I think that's for women.
For
pelvic
women?
floor rehabilitation. I think it's very effective. It's a little time consuming, and you need to be committed to it. It's like physical therapy. You have to go regularly. So if you have the time, the patience, the commitment, I think, and we know from the research, the people get really good results.
I've had several patients that were sort of surgical candidates that really didn't want to have surgery. They wanted to do everything non-surgical possible.
Yes.
And so I created some different packages for O-shots, Emcella, Thermiva combo, and it has worked. They've tightened up their pelvic floor. They're not leaking urine anymore, and they don't need surgery anymore. And they're so grateful, really grateful.
And there was no downtime from the
No
surgery.
downtime,
There wasn't meeting
no
a
risk.
$6,000 deductible, a mesh erosion, or anything like that. So we really did want to kind of just share with you.
And we're not saying people don't need surgery.
Of course they do.
Of course they
A lot of
do.
them do.
But this is for people who are on the border or don't really need surgery, but just want to live a better life,
Absolutely.
more joyful life.
If you need help with your sex life, if you need help with the function, if you want to work on your desire, give Dr. Runnels or myself a call. Come see us either at the Scarlet Phoenix or here at Dr. Rogers Centers. And I promise you, we've got a lot more tricks up our sleeve than the majority of gynecologists.
We have so many fun tricks up our sleeves, both of us. And I know Wendy's got so many that I don't know about because she's done some different trainings than I've done. She's super bright, super talented, super
so
skilled. She's awesome.
I love
So,
you. I just love you. Thank you for coming.
I love you. I just love you.
And thank you all for tuning in. So we will put all the information when we post the video later, links to the Scarlet Phoenix and to Dr. Rogers Centers. So come see us. I promise we can make things better. Good night, everybody.
Good night.